Hi, my name is Hannah. This is my response to the video discussion for Module 13. I'm going to be talking a little on Thread 2 on cancer and herbalism. So after reading the readings for this module as well as listening to the lecture, I do stand on the side that I don't believe that herbal medicine or alternative medicine belongs in conventional medicine and Western medicine, and especially not with treatment of cancer. We can see by the research presented that there are high risks on taking alternative medicines instead of conventional cancer treatment. The study by David Gorski shows that there is a 2.5 increased risk of death for breast, prostate, lung, or colorectal cancer patients, and a 5.7 increased risk of death for breast cancer patients if they use alternative medicines instead of conventional cancer treatment. Another data analysis done by the National Cancer Database studied 280 patients who fit the criteria of alternative medicines, and surprisingly enough, they were younger, female, and had lower comorbidity scores, which showed that people who tend to choose alternative treatments tend to be of higher socioeconomic status as well as healthier than an average person or someone with the same type of cancer. I believe they said that the majority of the people that they studied either had stage 2 or 3 cancer, and most of them were breast cancer. So taking into account everything that we learned this week, as well as the readings on cancer specifically, I personally don't believe that herbal medicine should be regarded as a legitimate form of medicine. I think in some cases it could be an additional form of medicine taken with kind of a standard treatment plan. I do believe that practitioners and people in the healthcare community should be concerned about alternative medicine, especially now that I feel like it has grown in popularity, just because people are vulnerable to believe that cheaper, easier outcomes with less side effects could work. Unfortunately, I'm split between whether herbalism should be regulated by the government, mostly because since there are so few studies done on herbalism and how it impacts health, as well as the negative results on most of those studies, make it kind of hard to set guidelines. I feel like with more traditional medicines, it's easier to set boundaries on what is acceptable and not. But with herbal medicine, since there's so many iterations of it, I don't think government would have a really easy time differentiating those boundaries. I do believe that the government and physicians and other people in positions of power do have a duty to educate the general public on the negatives of alternative medicine, and I think there should be a team built to put more education out there for the general public against alternative medicine.